Um, I'm Amanda Ryder. I'm the Director of Admissions and Recruitment here at CU Pharmacy. And I am joined today with Dr. Cindy O'Brien for this month's Mile High Meetup. So, Dr. O'Brien, I'll let you introduce yourself and a little bit of your background.
So hello everyone. So excited to have you here today. Excited to look forward to our conversation and to learn a little bit about you and hear the questions that you have. So I'm Cindy O'Brien. I am a professor here at the SCAG School of Pharmacy and Pharmaceutical Sciences. I also have an administrative role where I'm the Associate Dean for Academic and Faculty Affairs. So those are my two kind of primary roles here. I am an oncology clinical pharmacist. I've worked at CU for over 20 years, so I've been here for a long time. And my clinical practice is in our outpatient oncology cancer center. So we'll work with patients directly in that cancer center as part of a multidisciplinary team.
Oh, that's so cool. Dr. O'Brien, every time I get to hear from one of our faculty members, it's amazing how many hats each of you wear. Um, so for folks who are joining online, we'd love to know what questions you have. Feel free to either add them to the chat, or you can always, if you're feeling brave, you can unmute yourself and just ask it aloud. And then we'd love to hear questions from you. And if there are no questions to kick us off, then I can get us started with a couple of questions that I know I have, and maybe will kind of spark some interest. But I think to kind of get us started, and maybe especially if some folks are still learning about what different pharmacists' role looks like, what does a day in the life look like for an oncologist pharmacist?
So oncology pharmacists can have, you can work in different areas. So the days can look a little different. I work in the outpatient setting. So in my outpatient clinic, like I said, it's a very multidisciplinary clinic. We have physicians, we have advanced practice providers like nurse practitioners and physician assistants and pharmacists all sitting in the same room, team room, working together, identifying patients who have issues that pharmacy needs to be involved with. We're answering questions for those providers if they have questions about medications, either side effects or how to access them, or what the most appropriate medication would be for the patient, depending on what issue they're trying to manage that day. We actually also have our own schedule where we see patients, do a lot of education with them, looking at their medicines and making sure they're appropriate and safe for the treatment regimen they're going to be on. So our days are different. We come in, we don't really round per se on our patients because it's more of kind of an outpatient setting where patients are coming in at scheduled times. And when you're an inpatient pharmacist, it looks very different. If you're an inpatient oncology pharmacist, your patients are already there. You're not waiting for them to show up. And so in that setting, you do have more formal team rounds where the pharmacist will round with the medical team, discuss patient issues and concerns, things that are going on with that patient over the last 24 hours, talk about medications and what needs to be started or stopped. And so that looks a little bit different. You're doing a lot of discharge counseling and education for your patients. So it kind of just depends on the setting that you're working in from a clinical aspect. And some pharmacists work in an infusion center where they're integral in the reviewing of orders and making the chemotherapy and getting it out to patients. And then we also have investigational drug oncology pharmacists who are really involved in dispensing drugs and being part of the clinical trial process. So the day can be very different depending upon your area. So.
Oh, that's fascinating. And so I know the way that pharmacists work with patients vary depending upon what type of a pharmacist is. What does your patient interaction look like? And it sounds like you're working with patients quite a bit.
Yeah. So we actually have a pretty busy schedule in our clinic. Our providers like to utilize us a lot. for our drug expertise. So yeah, so like I said, we have our own schedule. So patients are put on a schedule to meet with us. And so that might be for education. So I'll go into a room and meet with patients and their families or their caretakers. And we'll sit down and really talk about, what treatment regimen they're starting, what are some common side effects associated with that. We talk about how to manage some of those side effects, either at home with, over-the-counter kind of treatment options or with prescription options that we're going to provide to our patients. So it's a lot of direct patient contact where we're talking, having discussions, asking questions, answering questions. Patients asking me questions, I'm asking them questions. And so that's a really fun part of it. We also do a little bit of assessment for our patients who are on treatment. And so if they're having an issue with a side effect, then we can meet with the patient and talk about, if their nausea is really bad, what's going on, how are they taking their medications, and working with the providers to adjust the treatment to make sure that they're getting good relief from the medications that we're giving them to help counter those side effects.
That's fascinating. And then what does your interactions look like with the other health professionals that you're working with? It sounds like you work with quite a few.
Yeah, yeah. So like I said, we have a really big clinic and have a lot of like cancer specialties in our clinic. And so we work with oncologic surgeons and medical oncologists, and like I said, our advanced practice providers. We also work with some other kind of supportive health professionals like social work and like I said, nursing. So we do have a lot of different providers. Our team is really collegial. Everyone really respects the expertise of each healthcare professional in the room. So a lot of times, our providers, either our medical oncologists or our advanced practice providers, will come out of a room and they've just spent time seeing that patient. The patient has, an issue that's popped up, and so they'll come over and they'll ask, this patient has such and such issue. What possibly can we give them for that? Or how best should we manage that? Or would this be something that you would expect with that medication that they're on? So it's a really, like I said, really collaborative environment. We utilize each other, right, for like I said, our expertise. And it's a really fun environment because we're all there to support our patients. And so we really do work well together.
Thanks so much. And I just had a question come in, and one of the questions is, are there any areas of pharmacy where you have minimal patient interaction? So a little different than what you do.
Yeah. Yeah. So in oncology, if you were working more specifically in an infusion center where your role is really more to review the orders and to help prepare the chemotherapy, those pharmacists don't have quite as much day-to-day interaction with the patients. They might be asked to come see a patient here and there, but most of it is really behind the scenes, preparing the medications, making sure they're prepared appropriately and safely, and they're getting to the patient in a timely manner. So in oncology, that's probably a setting where you don't spend quite as much time with patients on a daily basis.
And how did you find your way to oncology pharmacy?
Yeah, so it really started. I didn't even really realize it, but it really started in undergraduate with my major. My major was biochemistry, and I just love biochemistry and understanding all the different processes of the body and how they all work. So when I went to pharmacy school, we had a few, not a ton, but we had a few lectures in oncology, and it really kind of the way the drugs, especially at that time, when we used only chemotherapy to really manage cancer patients. Those drugs just really made sense to me because I understood the processes and how these drugs made an impact. So it was just something I was really kind of interested in. I did some fourth year rotations in oncology, and that just totally sealed the deal for me. I was able to be in environments where the pharmacist was just so integrated into the patient care team. Like I said, asking questions about drugs and really saw the expertise of the pharmacist in that setting. And that was it. I was sold. Yeah, not only could I help patients but I was, I felt like in that setting, you could be a really valued member of the team. So that's how I stumbled into oncology. And like I said, I've been in oncology for over 20 years and love it. Still love it to this day.
Oh, that's awesome. It's so funny. I feel like every time I talk to a pharmacist about how they found their specialty area, it's those rotations that tend to either introduce them to something or really, really confirm, no, this is my passion, this is what I want to do. Um, so experiential learning, there's nothing to replace the value of that. Um, what would you say is the most challenging aspect of your role?
Yeah, I think that, one thing that's really challenging is oncology changes constantly, which is a fun part, but also a challenging part. So sometimes just trying to keep up with all of the latest and greatest it can be a lot of work. So sometimes that can be a little challenging. And what you're finding with oncology pharmacists now is they're really beginning to specialize. So they'll specialize in a certain type of cancer instead of being a general pharmacist overseeing all types of cancer. Just because of the information is so it just comes out so quickly. You really have to become an expert in a specific area. So that could be a challenging part. And then, just dealing with patients with cancer can be challenging. We don't always have a happy ending, right, to our patient's journey with cancer. And so that's as you develop, especially in the setting that I work with, I really can develop relationships with my patients, and I know a lot about their grandkids or their their family vacations, and you really become kind of really friends with your patients. And so when that patient reaches the end of their journey, that can be quite challenging as well. So it's really helpful to have a focus on what you're there for. That will help you kind of manage those emotions as you go through them and experience them.
Thank you for sharing. We have a couple more questions coming in. One, are there any tips for someone who also wants to specialize in oncology? I know at SCAGS they offer classes and rotations related to oncology, but besides this, anything else you'd recommend someone who knows they want to do oncology work?
Yeah, so of course, the classwork that you have to do as part of your curriculum in a pharmacy school is essential, right? And then, as we talked about earlier, having an opportunity to do a rotation oncology, I think is really key. It really helps you decide, is this my passion? Can I manage the emotions that go on in oncology? So those two are key, as you mentioned in your question. I think an additional area that you could think about as you're in pharmacy school is doing some research related to oncology and oncology pharmacy. So, many times there'll be opportunities to do some kind of, you know, uh, kind of either an honors program or some kind of independent study research that you could do. So that can be also really valuable if that's, where you want to go and what you want to do. Because most likely you'll do residency training and building that skill of research. It'll be, very helpful as you progress through in training to become an oncology pharmacist.
Such valuable insight. And then I know you talked a little bit about the challenges. What is the best part of being an oncology pharmacist?
Yeah, well, the best part is the patients. I mean, I really do love the patients. They just all come in, and they're just so interesting and they're just so fascinating. And they really help you maintain a perspective of the world, right? So they come in sometimes with a terminal diagnosis and just the brave braveness of our patients and just the clarity of our patients and really focusing on what's important in life, I think is amazing and really helps me level set every day. You know, my outlook on life. I think the other piece that's really, super fun is our team, right? So that clinical team where we're able to sit down and really discuss, patients. And sometimes we're really discussing challenging patients where we don't know the answer and you can't look up the answer. There might not be any answer out there. So it's really kind of fun to be able to utilize the skills that you have grown and developed over the years and really work with other healthcare professionals to just really provide an optimal patient care process for our patients as they go through cancer.
I I feel it's always the people. For me, it's always the people. And so that makes total sense. Um, we have one of our attendees today is a little bit younger. They are 16 and they're wondering what are there ways to start exploring pharmacy, oncology pharmacy while they're still in high school or
Yeah, so in high school, I think probably if you can find volunteer opportunities within a cancer center, that could be a great exposure and kind of first, kind of dipping your toe into the pool of oncology. I know depending upon where you live, some cancer centers or universities might have summer research programs for high school students. So something for you to look at, maybe check with your high school counselors to see what opportunities might exist there. And then if none of those exist, don't hesitate to reach out to people. So, if you can do a little Googling or do a little searching to find out like who are oncology physicians or oncology pharmacists or advanced practice practitioners who work in the area, just emailing them and asking, is there a shadowing program at your institution? Here at our institution, we do have a shadowing program for high schoolers and people and students who are in college. And so they can work through the volunteer office at the hospital and they can go through that program and they can schedule some time to just come in and shadow providers and see what they're doing. And so we've had many students who are interested in pharmacy and who are interested in oncology pharmacy come and shadow me in my clinic. And so that's a great way to get some exposure in high school.
Oh, that's great advice. And yeah, shadowing seems to it can make such an impact. And then I just want to make sure everyone also knows that some shadowing experiences, if you have your heart set on a specific opportunity, some are limited to those who are 18 and up. So you may have to wait just a little bit to get into where you're wanting to go, but it'll be soon to get that exposure. And I love the idea of exploring those summer research opportunities. There are so many different camps out there that can really just exposure to all sorts of things in the healthcare field, which is really cool. Um, and so I also want to pause. It looks like we have a couple of people who are brave enough to turn on their camera. Did you all have any questions for Dr. O'Brien today? It's okay if you don't.
Um, yeah, I had a couple. One of my questions was just for like patients who are more interested in their medications and why, like a specific one over another. How do you go about explaining them in a way that's more understandable without getting like too into the weeds of like very specific pathways and stuff, just for helping them better understand?
Well, yeah, that's a unique skill that you really have to develop in oncology because sometimes the medications and how they work and how we choose one over the other can be really complicated. When you're really talking down to the cellular level of how some of these medications work. It's a skill that you build over time. I really try to find anecdotes and things that people can relate to. All right. So, when I talk about like how cancer metastasizes in the body, I use a Harry Potter reference and I talk about the disappearing cloak that Harry Potter puts on and, wanders through Hogwarts. And I try to use that as a kind of a reference for the patients who, some patients are too old, they don't understand Harry Potter, but for the patients who I think will understand that, you're really thinking about just distilling it down to the very basic kind of principles that they need to know. A lot of times patients don't need to know all of the details, but just need to have a basic understanding of the medications and how they work. And I think when you do that, it helps them understand why they see the side effects that they see. And then I think it also helps them understand just how important it is to take some of the supportive care medicines that we prescribe them, right? Because now they're understanding why they're experiencing that side effect and how they now can use those medications to either prevent or minimize them. So really, really important to do that. And it's kind of a skill you have to develop over time to be able to figure out how to distill it down. You have some patients that walk in, they want all the details, and you give them and they give them and their eyes glaze over. But yeah, it's an important thing because education to those patients is really powerful. And the more education you can give them, the more they feel in control of their disease and and what's happening. And so if you can educate them in a way that helps them with that, it's really powerful for the patient.
That was such a good question. Uh, yeah. Are there any other questions?
Here's one in the chat that I got from Shanique. So Shanique, I don't see you out there, but hi, how are you? So Shanique's question was, or Shaniqua, is it Shanique or Shaniqua? I don't know if she's still on.
It's Shanique. You said it right.
Okay, all right, I wasn't sure. Okay, so Shanique, thanks for that question. So her question was, do you need a fellowship with oncology? And so for oncology trained to be oncology pharmacists, fellowships aren't necessarily required. Typically what you'll see for an oncology pharmacist is they come out of pharmacy school and they'll do a first year kind of general residency, and then they'll do a second year specialty residency in oncology. If you want to go on and do more training, you can do a fellowship, but that's not required for most clinical oncology pharmacy jobs. That fellowship gives you a little bit extra expertise in research, so you can broaden your career options, and people can go into faculty. You don't have to have a fellowship for faculty, but you can go into faculty. You can go into more maybe lab-based research or working with a pharmaceutical company with fellowships. So it really just depends on what direction you'd want to take there, but they're not required for a lot of clinical oncology positions.
Hi, excuse me, I have a question, please.
Yeah. Hi.
Thank
Hi.
you. Thank you so much. Just, I don't know if you said it before, but the good, like the pathway for you to get to be an oncologist.
Yeah, so pharmacy school, for sure you have to graduate with your degree to
Yes.
be able to sit and become licensed. And then as I previously mentioned, a first year pharmacy residency, so those PGY1 residencies are required for you to do prior to doing a residency in oncology. And so you get this first year just kind of general pharmacy training where you're doing a little bit of inpatient, outpatient, internal medicine, critical care, all sorts of different, types of different rotations. And then from there, you go to a second year residency in oncology pharmacy. So you're specifically looking at working with patients who have cancer. So you might be working in an inpatient setting or an outpatient setting. You might be working with patients with solid tumors or patients with hematologic cancers, those patients who are getting transplants, either bone marrow or stem cell transplants. So that's really that path of pharmacy school, PGY1, and then PGY2 in oncology pharmacy.
Thank you so much. You can say like 6 years of study, like
Yeah,
4 years
so
of pharmacy school and 2 years of
yeah. So
residency.
4-year pharmacy school, and then 2 years of residency. Yeah, so 6 years.
Okay. Thank you.
Yeah, you're welcome.
And for those who are still getting familiar with all of the acronyms we use in pharmacy, PGY1 and PGY2 are post-grad year one and post-grad year two. Um, I believe. Please
Yeah,
correct me,
that is
Dr. Ryan. Okay. Um, any other questions from our attendees this afternoon?
Yeah, feel free. Anything you want to know.
Yeah, I had one more. I was just wondering if, as you know, someone who works in it, if there's any research that either you or your colleagues or just in the industry that you are seeing or you know that's coming up that's exciting for you.
Yeah, one of my roles here at the School of Pharmacy and in our cancer center is I am the chair of our protocol review and monitoring system, which is a big mouthful full of words. But what that committee does is it reviews all cancer trials that come into our cancer center, and we review them for scientific merit and feasibility. So there is some really kind of cool new immunological, like immunology type drugs that are coming down the pipeline, really looking at new ways to stimulate the immune system. And so, we've really come a long way from when I first started in oncology pharmacy. Like I said, I started just as we began to start seeing more targeted therapy. We were just really using just kind of general plain chemotherapy. But as we learn more about the biology of different types of cancers and different hallmarks of those cancers and really what's perpetuating growth, we've begun to use more targeted therapies. And then from there, we've gone into immunotherapy. And so immunotherapy really is, utilizing the patient's own immune system to fight the cancer, kind of like a virus or a bacteria, right? And so, we're still in kind of the burgeoning early areas of this, but we're starting to see a lot of new drugs developed that are able to link an immune fighting cell directly to the tumor through different receptors. And so it's kind of a really fun way, like you have to think about the science of it, the fun way of being able to pull that immune cell directly to the tumor to kill that cancer. Now, doing that can be pretty toxic, so you really need to be able to manage those toxicities, and that's where pharmacists really come in to help making sure that we're identifying and we're managing those toxicities kind of ahead of time, so that patients aren't, developing really severe toxicities and needing to be hospitalized. So there's a lot of really kind of cool stuff coming down the pike in the area of immunologic type of treatments for cancer. So
Awesome, thank you. I appreciate it.
yeah. All right. I think there's some other questions in the chat there, Amanda.
Yeah, we just had a couple roll in. So Alyssa asks, what are some of the challenges you see now and foresee in the future of pharmacy, especially as an outpatient clinical pharmacist in oncology?
So challenges for the future, I don't see quite as many challenges. I really see a lot of opportunity. Oncology pharmacy is an area of pharmacy that um, there's usually more jobs than there are enough people to fill them. As cancer centers grow and the role of the pharmacist is really changing and evolving. So, like I mentioned earlier, targeted therapy, we call that precision medicine. And in fact, just the other day, two of our graduates who now work at another university were just recognized by a big pharmacy association for their role in precision medicine and oncology. So they lead a big committee within a cancer center, and their job is really trying to identify very targeted drugs for specific patients. And so this precision medicine, I think we're going to see more and more pharmacists really move into that area and take a bigger lead in that area, just because of their knowledge of the drugs, their knowledge of the disease state, their ability to interpret pharmacogenomics. And so it's really kind of a perfect blend of pharmacy in that setting. So that's a really great opportunity. I think you're seeing more and more pharmacists do a lot of more direct patient care, not sitting behind a computer or a counter, really more direct patient care is another big area, I think, for growth and opportunity. So from a challenge standpoint, I think there's not a ton out there. I think it's really for not just oncology pharmacists, but pharmacists in general, is just getting provider status to really let us work at the top of our license and do things that we can do to help manage patients. I think that's probably the biggest challenge is that provider status, but it's not just only for oncology pharmacy, it's for a lot of areas of pharmacy.
And then,
Oh yeah.
oh yeah, and then a question about the multiple hats. How do you balance both your duties as an active pharmacist and your role as a faculty member?
Well,
And your role as an administrator.
a lot of times I just have a lot of balls in the air and I hope they don't fall. But it takes time to figure this all out. The good thing is that I'm not in clinic every day. So I'm not in clinic 5 days a week like some other clinical oncology pharmacists would be. So I'm in clinic. I have specific days of the week that I'm in clinic. And so when I'm there, I'm full in on patient care. And then when I'm out, I'm doing more things that are related to my faculty roles. So I have specific days that are assigned to faculty roles, specific days that are assigned to clinic. Every once in a while, they'll overlap a little bit, but it's just making sure that each day I have clear expectations of what I can do each day when I'm in either one of those settings. But a little bit they overlap, especially when I'm teaching, because a lot of what I'm teaching is what I'm doing in my clinical role.
I really appreciate the reminder of things will come in time, right? You'll learn to balance it all in time. You'll learn to have hard conversations with your patients in time, which I think sometimes is really, really helpful. Just that reminder that it'll come. We have one more question, and it may be one of our last ones, just to be respectful of time. But Fanny asks, given that oncology pharmacy is already a specialization, do you work with all cancers at the cancer center or more specific at their BMT center? If so, what do you recommend someone that wants to get even more specific in the oncology field do?
Yeah, so I work more in a more specific cancer type. So in my clinic is for GI cancers, for head and neck cancers. We also do sarcoma, and we also do surgical oncology. So I have kind of a broad clinic, but we have 13 oncology pharmacy specialists in our cancer center, and we have some that only do breast, that only do lung, right? That only do like GU or prostate type cancer. So you can specialize. We have 5 pharmacists that work in our heme and BMT transplant clinic. So you can really narrow down into those specialties, and that's what we see mostly at a major academic medical center. If you worked in more of a community hospital setting, you might be a little bit more of a generalist and see a lot of different cancers that come in. To get into the specialty training, it's really going to be doing that P2I2 residency program. That's going to give you a lot of exposure to the different types of cancers. It's going to help you kind of pick which of those you might be most interested in. And it really will give you the skill set to then go out and look for jobs specialized in each of those areas. Sometimes in a first job out, you might be doing some more general things, but then as you're there, then you can begin to specialize into a clinic. But a lot of times I'm seeing our residents go out and they're hiring specifically for a lung pharmacist or for a breast pharmacist. So that P2I2 training is really essential to help you get into those specialty areas.
And then we have a question, which is, how challenging are the 2 years to be an oncologist or an oncology pharmacist?
Yeah, so it's residency training, so it's not always a walk in the park, right? There are some long days and some long weeks. Typically, you're also working on weekends and doing staffing as part of your kind of educational or experiential training in those residency programs. But I'd say it's pretty manageable. I was the residency director for our PGY2 oncology pharmacy residency for about 20 years. Um, and so, really working with the residents to make sure that we're managing, balance, right? Making sure that as they're working hard, they're also getting some time off. But I would say it's really worth it. They say residency training is about equivalent to 5 years of working experience. And so if you really are dedicated and want to, be an oncology pharmacist, those 2 years are extremely valuable because it will really help you get to where you want to be faster. And it'll get you the experience and the exposure to that information and that knowledge in a more condensed way. Trust me, when I graduated from pharmacy school, I was like, oh, do I really want to do residency training? And then I was like, okay, I'm gonna do my first year residency. And then after that, I was like, oh, I really like it. Yeah, I really, really like oncology. I think that's definitely the direction that I want to go. I do want to do one more year? And so, yeah, I did it. And I was so grateful. I had classmates who didn't do residency training and they, really regretted that decision because it took them so much longer to get to where they wanted to be. So, I think it really just depends on where you want to be and where you want to go when you're done. But that residency training can be really, really valuable.
Yeah, and one of the things that reminded me of is everything in our pharmacy program really ramps up with you. And so it is that residency is going to be incredibly challenging, but it's not going to happen your first semester, right? And so always a nice reminder that your first year is a really good foundation and then your faculty will work to build upon that foundation. Um, so anyone who is panicking, don't panic. You
Yeah.
will.
Don't panic. We don't expect, that's why I tell, like, even when I was residency director, residents would come in and, they felt like they had to know everything about oncology in the first month. And I was like, no, that's why we're here. We're here to teach you this, like over the whole next year, right? So you don't have to know it all right now. Pharmacy school is exactly the same way. You don't have to walk in knowing everything about pharmacy your first semester. We're here to teach you about pharmacy over the 4 years. And so, and everything builds, right? And so we're building that knowledge, building your skill sets and really preparing you to go out and practice, safe and effective pharmacy. So.
And that's always the challenge I feel like so many people who enter the field of pharmacy want to be helpers. And so you want to be an expert immediately so you can start helping and it just takes time. All right. And one more question, and then we'll probably start wrapping things up just to be respectful of time. But can there be a gap between your 4 years of pharmacy school and your residency? Or should you start it immediately after graduation?
Well, I mean, I think it's really individualized per person, right? Some people are able to start right after pharmacy school. I think, if you're able to start right after pharmacy school, you're used to being in that student mode and that learning mode. And so it might be a little bit easier, but we definitely have seen students who've come back, like they've gone out to work and then they decide they want to specialize in a certain area, and then they come back to residency training. So either way is possible. It just depends on what works best for you and in helping you meet your goals.
Thank you so much. If there are any other questions, we might have time for one more, but I also want to make sure everybody has information around the FarmCast coupon codes. So we appreciate you taking the time to join us today and learn more. And also want to make sure that if a coupon code is helpful to help you kind of complete your next step to applying to CU's pharmacy school, that you have the information you need. In order to receive a coupon code, and the coupon code will be for the fall 2025 start. There is a short survey that I just dropped into the chat. If you click on that link, it'll take you to a short survey, and essentially I'm asking for your information and then also if you've applied to another pharmacy school at this point or not. And the main difference is if you've already applied to a pharmacy school for this cycle, then the coupon code that you'll need is $60. And if this is the first school that you're applying to this cycle, or if it's the only school that you're applying to, your coupon code will be $180 to make sure that we're covering the full cost of that application. It can take a little bit for FarmCast to generate the coupon codes. They are unique to both the institution and the individual receiving it. And so please allow a little bit of time for that processing. But if you don't hear from me by Monday, reach out and let me know. And then also if questions come up, you can reach out and let me know. If I don't have the answer, I usually know someone who does, and can also help get you in contact with Dr. O'Brien if you have any additional questions that come up about oncology. And so at this point, are there any last minute questions? Any either about the process or for Dr. O'Brien?
So Shanique did email me or put a question in the chat. I don't know if everyone saw it, but it's like any advice for applicants applying for this cycle. So I can just give you some general stuff, but Amanda probably can give you way better information for applying. But I say, put your applications in. Just make sure you clearly communicate your interest in pharmacy. And make sure if there's anything that you need to follow up with, quickly do so we can get you into the interview process and that admissions process. So I'll let Amanda answer any other questions.
Yeah, absolutely. I think the biggest piece as you're going through this application cycle is really just communication. So if questions come up, please don't hesitate to reach out. The admissions team the whole reason we exist is to help students navigate the application process. We know going through the application itself and going through the interview can at times be a little complicated, and also at times can be a little nerve-wracking. And so if you have those questions, you don't have to sit alone with them. You can reach out and let us know, and we're happy to help answer them, point you to resources, or sometimes just even kind of validate like, yeah, it's okay. All right, this is what's coming up next. And so if at any point you do have those questions, reach out and let us know. We really are super happy to help. And so, yeah, on that note, I just want to give a huge thank you to Dr. O'Brien. Thank you so much for taking the time. We mentioned the several hats that you wear, and the fact that you did take the time this lunch hour to join us and kind of share your experience just means so much. So thank you. Thank you. And thank you to all of our participants who joined. There were some amazing questions asked, and I know I learned a lot today too. And so just wanted to say thank you to everyone who joined us today. And for those who are applying to fall 2025, best of luck. And if you have questions, like I said, reach out. I'm happy to help. So don't hesitate to let me know if you're running into anything. And on that note, I hope you all have a wonderful, wonderful afternoon, and hopefully we'll see you on campus soon.
Thank you, everyone.
Thank you.
Yeah,
Thank you.
you're welcome.
Thank you so much.
Yeah. Have a great rest of your guys' day.